Hello, everyone. My name is Dr. Michael Wald, the Blood Detective, and welcome back to all the people that have been watching my podcast. I thank you for that. And hello to everyone out there that's new. This is a very important conversation. I've entitled it Breast Biopsies Spread Cancer. Do they or do they not? We'll get into that, and we'll also talk about some of the things that we can do on a daily basis to mitigate or lessen our risk of breast cancer in the first place. I am a doctor of chiropractic and board-certified nutritionist. I'm also a dietitian and sports nutritionist. I am a life coach and provide acupuncture to my clients, and I have two practices, one in Westchester, New York, and the other one in Richmond, Virginia. So this information is meant for your education. It's not meant as a substitute for sound medical or health advice. So can breast biopsies cause cancer spread? Well, the quick answer is yes, they can. But we need to understand a few things first. So why are breast biopsies performed? They're crucial for diagnosing breast cancer, its type, its grade, its hormone receptivity, and guiding other treatment options. Very rarely, as it said, needle biopsies can dislodge cancer cells, but the risk of actual cancer spread is thought to be low, estimated to be less than 0.01%. And we're going to discuss what that means right now. So if 0.01 to 0.03, that's the actual risk range, we're thinking that biopsies might dislodge cancer cells. So between these ranges, these percentages of women experience a certain outcome like cancer spread from biopsies. So if that's true, if it's 0.01% of women, that means that 1 out of 10,000 women will have cancer spread from the actual biopsy itself. And it may be as high as 0.03, which means that 3 out of 10,000 women. And some physicians consider these low numbers, but I think that they're not that low. I mean, they're real numbers, they're real women's lives. So let's focus in on a few other things we can do to mitigate risk. First, let's talk about these biopsies. So one way to mitigate risk is to use fine needle biopsy aspiration, FNA, or core needle biopsy with imaging guidance to minimize trauma. You want to ensure proper post-biopsy monitoring and follow-up with appropriate therapy if cancer cells or if cancer is confirmed. And it is thought that the benefit of accurate diagnosis far outweighs the minimal risk of spread from biopsies. And that may be true. But what we need to understand is that biopsies do increase risk, so they should only be done when absolutely necessary. And just as a side note, you should know, if you don't already, that for a woman or man palpating their breasts, if there is breast cancer there, it takes about 5 years of cancer cell growth for you to even feel it. And it's also about 5 years of growth until imaging tests like mammography even picks it up. That's why I'm in favor of MRI as one of the ways in which to look at the breast, along with sonogram. Those two will give a very, very good picture of what is in the breast tissue. So what are some preemptive measures to avoid breast cancer in the first place? And there are many things we can do, because most women who, and I'll focus this conversation mostly on women, most women who do get breast cancer are not BRCA positive. They don't have genetics that predispose them. That's less than 1%. And that means that those who do get breast cancer, it's from other factors which are thought to be environmental, and that obviously includes diet. So we want to maintain a healthy weight, because obesity and overweight increases estrogen levels and breast density, and that will increase breast cancer risk. And some of these basic things I'll be talking with you right now, women never hear about them. They never hear about them from their doctors. You absolutely, this is a big one, want to limit your alcohol intake. Even 1 drink per day slightly increases breast cancer risk. You want to exercise regularly. At least 150 minutes per week of moderate activity reduces various hormonal contributors to breast cancer, such as lowering the 17-beta estradiol level and inflammatory risk. And you want to avoid hormone replacement therapy, or HRT, as much as you possibly can. Even when it's medically supervised, hormone replacement therapy does increase risk of breast cancer, and specifically in women that have an increased risk. And you want to eat an anti-inflammatory diet rich in vegetables, omega-3 fatty acids, and low in processed foods and sugars. I know this sounds like common sense to some of you, but very important to reiterate. And then some other preemptive measures would be avoiding unnecessary radiation exposure. You want to opt for low radiation breast imaging like thermography or MRI, which I mentioned just a moment ago, along with ultrasound where appropriate. So some doctors are willing to not do mammography and instead do MRI and ultrasound. And we know from studies that MRI is very, very good for this, not to mention it doesn't provide any radiation to the body, it does not deliver radiation to the body. And then you want to perform self-breast exams regularly, so you really know what your breasts feel like. So when they change, you can detect that as early as you can. So early detection might avoid urgent or repeat imaging or biopsies that lead to detrimental effects potentially. You want to get regular screenings. Following your doctor's recommendation schedule helps catch benign changes early, reducing panic and unnecessary medical procedures. You also want to manage your stress levels because chronic stress influences immune function and hormonal levels, and also inflammation. And then you want to use what is known as targeted supplementing, which is going to include at least vitamin D, omega-3s. So targeted means, by the way, nutrients that are specifically shown in studies to help mitigate breast cancer onset and also helps the treatment. Vitamin D is absolutely one of those, omega-3 and DIM. And all of these support healthy estrogen metabolism and reduced breast density. Sometimes just breast density alone can hide cancerous changes. So you want to not include foods that are known to increase the breast density. And there are other conditions that might do that too. For example, hypothyroidism is associated with an increased breast density. And it's important to know what your issues are so you can treat those. And avoid soy products. There is a mix of opinion regarding soy and whether or not it's pre-cancerous or can promote cancer, I should say, or even help cancer on the other end of the spectrum. And there are very good studies that show both. There is a method of thinking about this, which means that if you know that you're at increased risk of breast cancer, you probably should not have any soy in your diet because it might act as estrogen. But if you don't have any breast cancer in your family history, including soy might actually help block estrogen. But even these two examples I gave you just now, they're not absolutely definable and will work that way. So because there's such a conflicting amount of scientific controversy regarding soy and whether or not it's preventative or causative or cancer promoter for breast cancer and ovarian cancer, I have my patients eliminated. And then the other thing that I'll do is to develop a personalized food plan for a person. I mentioned an anti-inflammatory food plan, but one food that's anti-inflammatory in one person may be pro-inflammatory in another. So suffice it to say that I'll figure out through testing and through conversation what the proper foods are for the patient, using laboratory as well. And then I provide nutritional supplements based on the needs of the patient, not just a couple of convenient nutrients like I named DIM and omega-3s and vitamin D, although those probably are really important for most everybody. If you lack other nutrients, which I just didn't mention, that's a problem for you. So we need to identify those and fix those things. And then when I compare your blood results, I'm going to compare you not just to women, your age and your sex, obviously, but want to compare you also to healthy ranges of blood. There are healthy ranges that are different from average ranges. And if you're interested in that, you can look up a podcast that I did called How to Read Your Blood Work on my website at drmichaelwald.com, or you can search any platform for Ask the Blood Detective and search for blood work, and it should show up. So that will about conclude this conversation. I hope it was useful for you. It gives you some insight about the statistics regarding breast biopsies and their potential for breast cancer, and also especially things that you can do to avoid breast cancer or reduce your risk of developing breast cancer as much as possible. Thank you so much for joining me, and I'll see you at the next presentation.